Oh yeah. So crafting a compelling title is such an important, and it shows that you did our research, you don't know how to name it, and people don't understand and don't look into your paper. First thing, and easy tips, if you do it with the big name, like Carol, Todd Albert, Lenke, and Dr. Hines, which they're all live, and now you will know the big name in this field, and everyone who talk after me is a lot bigger than me, so just remember their face and then try to catch up. So you've got a very good publication, because everyone knows their name and then want to read their literatures. If not, you have to know the purpose of compelling title, the abstract reader attention. Your title is the first one, as I said, and sometimes only things that people looked into it at the first place. So you have to make it, interesting. How? You have to communicate a study focus, because people is now looking into the quality papers, which is, if you have that quality, like the randomized control trial in your name of the paper, they'll look into it because they think that's a quality one. And also you have to have the index and discovery words in it. So you have to shout out your paper that you are working on this title, this field of your, especially your spine surgery, or you're interested. So I'm looking into the olive. I'm working on the olive a lot. And when I'm looking into the indirect decompression, first 7, first 10, you can list recently in the PubMed. And what you're looking into is the keywords, right? You're looking into indirect decompression with an olive. Now, if that's your case, if that's what you're working on, you have to put it in your title. So it makes people understand what are you working on. And if they want to look into it, they're pretty much easier than looking into your abstract. Okay? So make it visible. So I'll do the example of only my literature. While working on the expandable corridor, Olive has a corridor. Comparing with two published paper, which one looks more interesting? You cannot judge, right? Because it depends on how you interested. Because one is like a descriptive, one is kind of like a question, could you do it? So one is more like a basics, one is more clinical. So it depends on who you're working on, which journal you're working on, and which studies are you working on. So you cannot judge. It depends on the reader, and it depends on the journal that you choose, if that's a basic or if that's more like a clinical. So this comes to the studies, characteristic and hotspot of 50 most cited. Because if they are cited a lot, it means they are interested and they are visualized by the other readers. So now with the MIS, the pre-psoas oblique, if you want to be visualized, that's one journal that has already published a lot in world neurosurgery. 1,726 citation was found. And also the top 10 most citation words are complication. Now if you're focused on complication, people are looking for it because tons of people now can do the olive. And now they're looking for how not to do it or how to prevent it. So if your study is working on it, you have to have the keywords like this: complication, decompression, spine surgery outcome, transpsoas approach, spondylolisthesis, anterior disease, and injury. So if you look at the first words, it dictates how interested in people to the olive. So there's several types and formats of the titles. It should be descriptive, declarative, or interrogative. So it depends on your study. So descriptive title, which one is appropriate? So it's mostly appropriate for the epidemiological observation, clinical radiographic characterization, like I said, the MRI character of the expanded corridor, descriptive of surgical outcome, technical flow demonstration, but it is less suitable for comparison, prediction, or hypothesis testing. So if you're comparing two of them, descriptive title is not the one. Cause and effective relationships and evaluation of an intervention. So these are the example of the descriptive. Looking to the risk factor of things, risk factor of unsatisfied outcome, prevalence, clinical impacts, or indirect decompression effects to the olive surgery. So these are more descriptive. Declarative, in other ways, is appropriate for clear, strong, defensible conclusion. Finding is novel and clinical important. You can declare it in your title. And also, if the study has confirmed the hypothesis, and if you say yes and the result is yes, you have to shout out, it's a yes for your paper. And it intends to capture attention with definitive statement. So this is more attractive to clinicians. They want to look into which. Is this possible? Is this positive outcome? Or this is predictable? But it is less suitable for descriptive exploratory study, retrospective observational study, because there's a lot of bias, and also inconclusive mixture results. Like this, what I did publish in the COR, there's no difference in pain after surgery with the steroids mixed with the NSAIDs injection. Interrogative is the aim of research. For exploratory, you still have question, uncertainty, controversy, unclear results, and you want to know if this okay or not, and it can compare techniques and risk factor. It is less suitable for the clear, concluded results, and everyone knows what is the results. So these are the thing. Start with the question, is there and how's that? And for my conclusion, best practice should be concise, less than 10 to 15 words, have a keywords and not controversy. And slightly for an example, this is my paper. It is good, have index, focus, have the study. But the thing is, the words is a bit too long. People don't understand, don't want to read it for so long. You can cut these unnecessary words. So common mistake, that's too vague. The conclusion is too strong. People don't want to read it, and the length is too high. So these are the checks that, for the newbies, you can check if your title is okay or not. Thank you.